Not every heart attack announces itself with crushing chest pain and a hand clutched to the sternum. Some of them start on an ordinary Tuesday, in a bathrobe, with a cup of coffee going cold on the counter, 3 feet from where someone just collapsed. I want to tell you about a patient I'll call Diane. I'm a cardiologist. I've spent my career learning that the most dangerous hour of most people's day isn't a dramatic one. It's the first hour after they wake up. And there are 5 completely ordinary things almost everyone does in that hour. Things that feel harmless, even healthy, that quietly stack risk on a heart that's already working overtime. Before I get into them, I want you to actually think about your own morning. From the second your eyes open to the moment you leave the house, what do you do, in order? Write it down in the comments. Not the polished version, the real one. Here's why that hour matters more than any other. Your cardiovascular system doesn't ease into the day, it launches. In the first 30 to 45 minutes after waking, your body releases a sharp spike of cortisol. Researchers call it the cortisol awakening response. And in some people, it's a genuine surge, not a gentle rise. Your sympathetic nervous system, the go system, switches on. Blood pressure climbs, heart rate picks up, and after 7 or 8 hours without water, your blood volume is a little lower than it'll be the rest of the day, which means your heart has to work slightly harder to move it. None of that is dangerous by itself. It's just Tuesday, biologically speaking. But several large studies looking at when heart attacks and strokes actually happen have found the same thing. They cluster more in the first several hours after typical wake times than in the afternoon or evening. Not because mornings are cursed, because that's when the physiological load is highest. And if there's already a weak point in the system, stiff arteries, unstable plaque, undiagnosed disease, that's when it's most likely to show itself. For a healthy 30-year-old, this window is a non-event. For someone with years of cardiovascular wear, it's the part of the day worth the most respect. Here are the 5 things that quietly make it worse. The first mistake is medication on an empty, dehydrated stomach. Millions of people take blood pressure or heart medication first thing, on no food and barely any water, because that's the habit their doctor's instructions turned into. Here's the piece that often doesn't get explained. Some blood pressure medications are absorbed faster on a completely empty stomach. Combine that with the lower blood volume you already have overnight, and in some people, especially older adults, and especially anyone already prone to lightheadedness, that combination makes a blood pressure dip on standing more likely. Doctors call this orthostatic hypotension. It's a well-documented reason falls happen in bathrooms, and falls in a small tiled room are genuinely dangerous. I'm not telling you to change your medication routine. Please don't do that without your doctor. What I am telling you is this is worth a real conversation, not silence. Drink a full glass of water and eat something small, crackers, half a banana, before your morning dose if your doctor gives the okay, and mention any morning dizziness to them directly. It's a 2-minute conversation that a lot of people never have. The second mistake is straining in the bathroom. This one sounds absurd. Nobody thinks of the bathroom as a cardiovascular event, but bearing down hard against a closed airway, what's called the Valsalva maneuver, genuinely does spike pressure in your chest, briefly reduce blood return to your heart, and then cause a rebound surge the moment you release. It's a real, measurable physiological event. Cardiologists actually use a version of it in clinic to test how certain hearts respond to sudden pressure changes. For most healthy people, this is harmless. Your body absorbs it fine, every day, without incident. But if you already have significant heart disease, an arrhythmia, or a known aneurysm, straining is very likely something your cardiologist has already flagged for you. If they haven't, and you fall into one of those categories, it's worth asking. For everyone else, the fix is simple and has nothing to do with fear. Stay hydrated, don't hold your breath, and push. And if chronic constipation has you straining most mornings, that's a normal, unembarrassing thing to bring to your doctor. The third mistake is loading emotional stress into the first hour. Phone buzzes. Eyes aren't even focused yet. Thumb is already scrolling. A stressful headline, a tense text, an argument about money before either of you has had coffee. Every one of these releases additional stress hormones into a system that's already running its highest hormonal load of the day. This isn't a stretch. Acute emotional stress measurably raises blood pressure and heart rate within seconds. That's well established. There's even a recognized condition, stress cardiomyopathy, where a sudden emotional shock temporarily affects how the heart pumps. Researchers have documented upticks in cardiac events tied to major emotionally charged events. Evenings after big losses in international sports tournaments are one of the more studied examples. The fix costs nothing. Leave your phone in another room for the first hour. If a hard conversation needs to happen, it can happen at 10 a.m. instead of 6:45. Your nervous system gets a say in the timing, even if your inbox doesn't. If this is useful so far, subscribing genuinely does help. Not because I need the number, but because the algorithm mostly shows this kind of video to people who already watch this kind of video. If you know someone this could help, that's who a share is actually for. Quick round, because a few things about this topic get exaggerated online just as often as they get ignored. Myth: cold water is more dangerous than hot water in the morning. Fact: it's less studied, but sudden cold exposure has its own, different cardiovascular reflex. Neither extreme is the goal, moderate is. Myth: if you're young, none of this applies to you. Fact: the morning physiological spike happens to everyone. It's just that young, flexible arteries handle it without issue. This becomes relevant as arteries age, or if there's undiagnosed disease at any age. Myth: a racing heart for a few seconds after waking means something's wrong. Fact: a brief flutter or a few fast beats on waking is extremely common and usually not dangerous. What matters is a pattern, recurring, worsening, or paired with other symptoms. More on that in a minute. Back to the list. The fourth mistake is a hot shower straight out of bed. This one feels like self-care. Stiff muscles, cold morning, steaming water. It feels like exactly the right move. But heat causes rapid vasodilation. Your surface blood vessels widen quickly to release heat, which pulls blood toward your skin and away from your core. Combined with a heart that's already managing the morning's hormonal load, this can cause a real drop in blood pressure. For most people, that's mildly uncomfortable at worst. For older adults, anyone with autonomic nervous system issues, or anyone already dehydrated, it's a genuine, well-documented cause of dizziness and fainting, and a wet shower stall is a bad place to faint. The fix: lukewarm to start, adjust up gradually, keep it shorter in that first hour, and drink water before you step in, not after. The fifth mistake is not the shower, not the meds. This is what happened to Diane. For months before her collapse, Diane had been mentioning things to her family. Offhand, between passing the coffee and talking about her grandkids, a tightness across her chest some mornings that eased after a few minutes. Tingling down her left arm she blamed on how she'd slept. A breathless feeling climbing the stairs that she chalked up to being out of shape. Every time, someone, including doctors who saw her briefly, reassured her. Probably nothing. Probably age. Probably anxiety. Probably is the word that puts people in ambulances. What she was describing were textbook warning signs of unstable angina, episodes where the heart's blood supply is intermittently, not permanently, restricted. Chest tightness that comes and goes isn't automatically less serious than chest pain that stays. Sometimes it's the early warning a constant symptom never gives you. One Sunday morning, it stopped being intermittent. She survived. The details of what followed aren't the point. The point is the months before it, when the information was already there, being said out loud, and dismissed. If you or someone you love has recurring, not constant, recurring, chest tightness, arm discomfort, unexplained breathlessness, palpitations, or dizziness, that's not a symptom to monitor casually. That's a stress test and an evaluation. It takes under an hour. Waiting doesn't shrink the problem, it just removes your ability to catch it early. This is the 5-minute protocol. This is what I actually do every morning now, and what I've had patients build into their routine. Minute 1, breathing. Stay in bed, don't reach for your phone. In through the nose for 4 counts, hold for 4, out through the mouth for 6. Repeat 5 times. A longer exhale than inhale is what nudges your nervous system out of alert mode. Minute 2, hydration. A full glass of water, left on your nightstand the night before. Sit up on the edge of the bed first, don't stand yet, and drink the whole glass. Minute 3, circulation. Still seated. Rotate your ankles, 10 circles each direction. Pump your feet like you're pressing a gas pedal. This activates the calf muscles that help push blood back up toward your heart and brain, a genuinely useful trick for anyone prone to lightheadedness on standing. Minute 4, gentle movement. Roll your shoulders. Turn your head slowly side to side. Reach your arms overhead. You're waking up muscles that have been still for 8 hours before you ask your circulatory system to also handle you standing up. Minute 5, the actual transition. Stand slowly. Pause. Check in. Any dizziness? Any grayed out vision? If so, sit back down for another minute. If not, walk to the kitchen or bathroom without your phone, without rushing. 5 minutes. That's the entire cost of the safest possible version of this hour. Comment which of these 5 you're doing right now, just the number, 1 through 5. Be honest. Almost everyone watching is doing at least 2 without realizing it. If someone in your life is over 60 or manages blood pressure, diabetes, or a heart condition, this is worth sending to them today, while it's on your mind, not after tomorrow's version of this exact morning happens again. Diane's coffee sat on that counter for 6 hours before anyone touched it again. I think about that mug most mornings, right around minute 2 of my own routine, glass in hand. It's not a dramatic thought, it's just a quiet one, a reminder that the ordinary version of a morning and the worst version of a morning start out looking identical. 5 minutes is the difference. Next week I'm covering the other half of this, the evening habits that quietly set up tomorrow's danger window before you've even gone to bed. If today helped, that one will too. Take care of your heart. It's been running since before you were born, without a day off. 5 minutes is a small thing to give it back.